Hello. We are back with the part 2 of chapter bone. First part में हमने उसको classify किया था according to location. Now in this part we will classify according to the shape and according to the microscopic and macroscopic levels. So now we'll start with the second type of classification, types of bone on the basis of shape. On the basis of shape, bones are classified into 6 types: long bone, short bone, flat bone, irregular bone, pneumatic bones and sesamoid bone. अभी हम एक एक को डिटेल में देखेंगे. Long bone, these bones typically have a elongated shaft and 2 expanded ends, one on the either side of the shaft. The shaft is known as diaphysis and the ends are called as epiphysis. So basically it has 2 ends, upper end and lower end, and the middle elongated part is called as shaft of the bone. So the upper end is connected to the shaft by metaphysis, and the lower end is connected with the shaft with the second metaphysis. So the ends are called as epiphysis, the middle part is called as diaphysis, and the connection is called as the metaphysis. So basically we have all our human bones, like in the arm, in the leg we have long bones, for example humerus, femur, tibia, radius, ulna, etc. These are the example of long bones. Now short bones, these bones are short in the posture and can be of any shape, मतलब short in their structure. For example, we have carpal bones in our wrist and tarsal bones in our foot. You can see in the diagram. Scaphoid, lunate, triquetrum, pisiform. These are the example of carpal bones, which are the part of short bones. Now the third one is flat bone. These bones are flat in appearance. Flat means they एकदम चिपटे हुए flat type structure होता है. For example, in our body we have scaphoid. Scaphoid is present on the back of the thoracic cavity and ribs present on the rib cage. And sternum also, which is the chest bone. Now the fourth bone is irregular bone. These bones are completely irregular in shape. For example, we have vertebrae in the vertebral column. Fifth one is pneumatic bone. Pneuma means space or cavity, hole in the bone. So pneumatic bone can be categorized under the irregular bones, but the characteristic difference is the presence of large air spaces in between them. So these bones makes the light in weight and thus helps in making a major portion of the skull. So these pneumatic bones are found on the skull area. For example, frontal bone, ethmoid bone, maxilla, sphenoid, etc. Now the fifth bone is sesamoid bone. These are in the form of nodules embedded in the tendons and joint capsules. So we have patellar bone, which is an example of sesamoid bone. We have pisiform bones, which is an example of carpal bones present in our wrist. Now the next classification is on the basis of the development. So on the basis of the development, it is divided into 3 categories, means how the bone has developed from its origin. So the first one is membranous bone, second is cartilaginous bone, third one is the mixture of membrane and cartilage called as membrano-cartilaginous bones. So the membranous bones ossify in membrane from mesenchymal cells. So for example, the bones of the skull or the fascia are the example of membranous bones. Cartilaginous bones, the name itself suggests it originates from the cartilage. So the ossify in cartilage and derive from the cartilaginous modules. For example, we have thoracic cage. These cartilage, the sternum connected to the rib with the cartilaginous bone. The third one is membrano-cartilaginous. They ossify partly from membrane and partly from cartilage. For example, clavicle, mandible and temporal bone. So the last classification of bone is based on their structure. So we have 2 types, macroscopic and microscopic. Macroscopic we can see with naked eye, and microscopic we see under the microscope. So macroscopic, it is classified into 2 cancer of a bone. The last part is dentine or cemental bone. They are specially present in the root of the tooth, and they are act as a adhesive glue. So dentine is one of the hard tissue of the